Hey everybody, my name's Ryan, and the theory that I'm going to be doing my theory review on is interpersonal psychotherapy, or IPT. So the theory founders are Dr. Gerald Clareman, Dr. Eugene Pakel, Bridget Prusoff, and Dr. Myrna Weissman. The theory was conceptualized at Yale, and essentially these four researchers came together wanting to establish more effective treatments than the popular tricyclic antidepressant treatment. So at the time, a combination of psychodynamic theory geared therapy, and tricyclic antidepressants, or TCAs, which are a class of antidepressants. The combination of those two things were the popular treatment for depression. This team of researchers found that this treatment was not successful in continuously reducing acute symptoms of depression. So if you went off one or the other, uh, relatively quickly, you'd be back to where you started, essentially, was the problem here. Um, and one of the problems with this was that some people thought that the pharmacological solutions were reducing the efficacy of the counseling solutions, and vice versa. So there were basically two schools of thought about this. So the first one was that if you were taking medication, the talk therapy would undo everything that the medication had done, which so basically the medication makes you forget your problems, and then going to talk therapy makes you talk about your problems. So it's undoing what they thought the pharmacological solutions were doing. And then on the flip side of that, people thought that taking medication just completely reduced the efficacy of talk therapy. It made it sort of moot. So the research team wanted to establish more effective treatments than the popular tricyclic antidepressant treatment. I think I already said that one, so I'm going to move on. Essentially, then, Dr. Clareman wanted to find an effective short-term counseling intervention to treat acute depression. So he created IPT, which was based off of high contact therapy, but as opposed to high contact therapy, it's short-term high contact therapy. So you see your counselor once a week, but you only see your counselor once a week for a couple weeks at a time. How IPT views human nature. This theory is mainly geared towards acute short-term intervention for event-related pathology and mostly mood disorders. So as the name suggests, these pathologies, generally depression or anxiety, are related to interpersonal relationships. IPT theorizes that our moods and our life events are related. So while this sounds really arbitrary, it is the basis of the theory as a whole. And basically, it's saying that this theory believes that pathology is not inherently in human beings. We're not pathological beings. We encounter situations, events, stressors, people that make pathology manifest in us. And so when our interpersonal needs or wants are incongruent with what we're getting from our interpersonal relationships, pathology develops, basically. So according to IPT, then, the person is not the problem. The event or stressor is the problem, and getting through that is what IPT wants to work on. So the focus of IPT is more appropriately coping with the stressor or event. The most important part about that is that the client should know there's nothing wrong with them. There's incongruity in their situation causing them distress. There's nothing inherently wrong with the client. How IPT views problems. So IPT views problems as situational, not personal, and I mentioned this a little bit in the last slide. But basically, viewing problems this way helps clients know that they're not at fault and that they have more control over the situation than they might think that they do. Also, I'm sorry, my dogs are running down the stairs, so you might hear them. IPT views problems as treatable. So since this is a short-term intervention, the point is to quickly get the clients to realize they're in control, and then give them the autonomy and the efficacy to actually take control for themselves. So one of the goals of IPT is to have clients internalize the strategies in this theory or in the counseling room, so that they can have the autonomy to handle these situations in the future without needing a counselor necessarily. And then in addition to that, IPT views problems as passing or event related and a result of psychological distress. So yeah, basically IPT does not view pathology as a lifelong problem. It views it in accordance with stressful events or stressful interpersonal relationships. They're simply reactions to events that people don't know how to cope with appropriately. How IPT views solutions. So IPT is a time-limited intervention that lasts anywhere from 10 to 12 sessions. I did find a few sources that said that it could last up to 20 sessions, but those were a little bit rarer. So I chose to go with 10 to 12 because that was the most popular number that I found. And these sessions are largely determined by the progress of the client. So the quicker they agree to grasp, the quicker they agree to use this strategy, and the quicker that they grasp the way that the strategy is working, the fewer sessions that you'll likely need. This can also depend on the severity of the problem, though. So a person that's dealing with complicated bereavement or the death of a loved one may not be able to directly address the person that they're having an issue with, or the problem in the interpersonal relationship, because that person is obviously has passed away. As opposed to somebody who's having a marital problem, they can address their spouse. Most likely, they can address their spouse and have a dialogue with them about what is wrong in the relationship. So just depending on the presenting problem or the cause of the stressor, it may cause a client to be here for a little bit longer or a little bit shorter. And then sessions in IPT are broken into 3 categories: a beginning, a middle, and an ending stage, all with very clear goals and specific allotments of time to achieve those goals. And those are what we're going to talk about next. So the first stage is the beginning stage. The amount of time you spend in this stage is anywhere from 1 to 3 sessions. And the goal is to identify specific mood disorders that a client is presenting and how it is affected by their interpersonal relationships and or the situation that they're going through. So the important part here is the process of taking an inventory of the client's interpersonal relationships to identify where the underlying problem is. So for example, which interpersonal relationship is causing this disorder to manifest? As I mentioned before, that can be the death of a family member. That can be a marital problem. That can be friendship troubles, role transition, things like that. Additionally, the counselor may want to identify what it is the client is suffering from in relation to this disorder. So I know those sound really similar, but the difference between them is that, say a client comes in and they've manifested depression or depressive symptoms. You want to identify what is causing those depressive symptoms and then give it a name outside of depression. So you're manifesting depression, but you're manifesting depression because of complicated bereavement or the death of a loved one, or you're suffering depression because of role dispute, so a marital disagreement or a relationship disagreement. You're experiencing depression because of role transition, so moving from an undergraduate degree to a graduate degree program, things like that. So you want to take it outside of the client, basically. And in doing that, you make it not the client's fault, which is the most important part. Is that they're not at fault for what they're suffering or for what they're undergoing, and that they're in control. And then finally, that what they're experiencing is treatable. So there's a lot that goes into that, but those are sort of the three big ones that you want to make sure that the client knows, is that it's not their fault, they're in control, and that what they're going through is treatable. And then the counselor wants to bridge the presenting mood disorder and the event-related causation. Okay, that's what I just talked about. And then the final piece of the beginning stage is to suggest IPT as the intervention of choice. And if this is agreeable with the client, then IPT intervention strategies will be the focus of therapy until termination. The next stage is the middle stage. So once the client agrees to using IPT as the intervention strategy, the counselor moves to the the counselor moves to the middle stage. And this can take anywhere from 9 to 11 sessions, or if I'm doing my math correctly, up to 17 sessions. And the middle stage technically includes the ending stage, but I'll get into that a little bit later. And this is the most substantial part of this theory, basically. So the goal is to employ strategies in helping the client resolve their symptoms and better cope with their disorder or distressing event. So some topics can include dealing with grief in a more appropriate manner, which would be complicated bereavement, resolving relational struggles with a partner, close friend, or family member, which is role dispute, mourning the loss of a role and learning to embrace a new one, which is role transition, and then even increasing socialization, which is interpersonal deficits, and I'll explain that a little bit more in detail in a second. So the counselor wants to empower their client by instilling in them the knowledge that they're greater than their situation. So, in other words, the client is more in control than they think they are. They can overcome their symptoms, and this can be achieved by teaching clients how to appropriately be assertive in having their needs or wants understood and met in interpersonal relationships. So, teaching a client to communicate with their peers or their loved ones in their interpersonal relationships where they feel that their needs are not being met is important. Validating the emotional reactions commonly found in interpersonal relationships as the counselor is really important. You want to make the client feel as though they're not weird or wrong in having the reactions that they have. That being said, however, you want to make sure that they're expressing those common reactions in a healthy or appropriate way. So if a client comes in expressing anger, anger, if they're expressing anger towards their spouse, that would be a role dispute. And so you want to validate the fact that they can be angry at their spouse for what their spouse is doing, but you want to make sure that they're expressing that in an appropriate way. So it's probably inappropriate for them to throw things at their spouse and to yell at them constantly, and to call them names or anything like that, right? So you want to emphasize healthy ways for them to do this. So having a dialogue with their partner, just conversing and telling them rather than screaming at them and throwing things at them, because that might be an inappropriate way of coping or expressing their feelings. And then lastly, you want to encourage them to take appropriate social risks. And this is what I was talking about that I would get to earlier. So encouraging them to take appropriate social risks relates to increasing socialization. So at times, people who are presenting depressive symptoms can withdraw into themselves, and you want to encourage them to sort of break out of that shell. So you can do this by encouraging them to take appropriate social risks in that they try hanging out with new people or hanging out with old people that they just haven't not old people, but hanging out with people that they've known for a long time but just haven't spoken to in a while. This can be in the form of going to a party, going to the gym, going to a family gathering, things like that. So just increasing their socialization in order for them to sort of break out of that shell of withdrawing into themselves. And then additionally, the counselor wants to empower their client by instilling in them the knowledge that they're greater than their situation, which I've talked about at this point. So then the last piece of this is the ending stage. So near the terminal stages, the counselor should acknowledge that their time with the client is coming to an end. And this should be brought to the attention about 3 sessions before the therapy is supposed to be terminated. So anywhere from the 9th to the 17th session, if it goes 20 sessions, the latest you should do it is the 17th session. The goal here is to emphasize that the relationship is reaching termination and that the client has autonomy over their situation and is independent of the counselor. So without blindsiding the client, you want to let them know that the counseling relationship will likely come to an end if they're ready for it too, which in this theory, theoretically, by the by the 12th or the 20th session, whichever one you go to, they should be ready to terminate the relationship. And then also emphasizing the fact that they can handle their problem without the intervention of a counselor. So emphasize their autonomy, basically. The counselor will also want to highlight progress made throughout the session, or throughout the sessions. And then lastly, the counselor wants to, or should make it clear that terminating the relationship is likely going to be a transition for the client, and that they may experience difficulties in coping with that. So this is another role transition that may be difficult for the client. And you want to let them, and you want to be very upfront and honest with them, and that might be difficult for them. One way to remedy this is one way to remedy this potential hardship is seeing the client less frequently. So instead of once weekly, you might want to see them once monthly or once every 3 months or something like that. Would I use this theory? Yeah, I would use this theory. I think this theory is actually really cool. I think this theory could be used as a screening tool, essentially. If a client comes in expressing depressive or anxious symptoms, and I find out that it's sort of event related as opposed to pathological in nature or reoccurring in nature, it might be helpful to use this strategy in order to quickly help this or more quickly help this person cope and learn coping strategies than long-term counseling. So yeah, I like this theory, and I think it could be really useful in practice. And there are my references, and thanks for watching.